Welcome to the special edition of Reformasi Dispatch. I'm Jeff Hutton.
And I am Kevin O'Rourke.
We're doing something a little different this time. We had a great interview with West Java Governor Ridwan Kamil just yesterday on Friday. So we're recording this special intro Saturday midday in Jakarta. And just because events are moving so fast, we wanted to get it out because we're afraid it would go stale if we stuck to our regular publishing date. I was really thrilled that the governor would take some time to talk to little old us, and he seemed pretty busy, not overwhelmed, just really busy and focused. I was wondering what your takeaways were, Kevin.
Yeah, absolutely. It was unusual that there was no small talk or pleasantries at the outset. His staff said that there were 30 minutes available for the interview, and we did the interview for 30 minutes. And he sat down to start and said, "Okay, let's start." So it was great. So that way he ensured that the available time was maximized. But he conveyed the impression of being very businesslike and very serious and somber because his province, which is Indonesia's largest by quite a margin, is really in the throes of a pretty serious crisis.
Yeah, he wanted to make clear that he's across the severity of the crisis, and that a large swath of the population have been very badly hurt. Said something in the neighborhood of 60% of the residents are getting some sort of social assistance. That just seems like a really high proportion, and that there's another fairly significant chunk of the population that don't even appear on anyone's radar. He called them undocumented, and because you and I come from North America, we think undocumented, we think migrants, but what did you think he was talking about there?
Yeah, people living off the grid in remote areas. West Java is very mountainous, and so you can find nooks and crannies where people have relatively little contact with the formal economy, and they're the ones that are chronically difficult for social services to reach. And I think it's interesting that he was pointing that out as a matter of concern, as it's something that often gets overlooked.
I think that's the first time I've actually ever heard it mentioned from a significant local leader. I mean, I'm sure it's on your radar, but it's of note. He also said he's going to be going out on a scooter and handing out sembako.
Yeah, it was a very informative discussion. So we spent about the first 15 minutes providing a broad overview, and then we honed in on the issue of healthcare workers, which is rapidly becoming, I think, the foremost crisis, or the kind of the most urgent aspect of the overall health crisis right now, because the coronavac vaccine from Sinovac in China is not really adequately protecting healthcare workers who are fully vaccinated. There are quite a lot of breakthrough infections. It does not seem as if there's many deaths at all yet, but healthcare workers in large numbers are having to isolate, and some are getting sick. And so it's exacerbating the shortage of healthcare services, and it's also jeopardizing the vaccine rollout because they're the ones who have to administer inoculations. So the governor addressed that and gave a bit of an update and talked about recruiting volunteers to fill the gaps.
Yeah, medical students, nursing students, members of the military are going to be filling in. I asked him about a likely time frame for herd immunity. I almost said herd mentality when I was asking him the question. Hopefully that got edited out. But and he didn't really want to hazard too much of a guess, which I thought was surprising when he had just finished telling us that there is a goodly amount of vaccine on the way. But he's only had about 9 million doses. So he's not confident about how that particular cookie is going to crumble. Like when policymakers in Jakarta divvy it up will he get the proportionate amount? I was reading a bit of subtext there. There's some wheeling and dealing on who gets vaccine. I thought that's something to watch.
Yeah, he reiterated that a couple of times, that his province has a population of almost 50 million, which ranks it above most countries in the world. And so far they've have had an allocation of 9 million doses, which is enough for fewer than 5 million people. And so it highlights kind of the stark contrast between Jakarta, where the fully vaccinated population is already 22%, and it shows that West Java is in for a tough ride because they've got a long way to go. The infections in West Java seem to be on a plateau right now, or maybe trending down slightly. And governor told us that the bed occupancy ratio in the hospitals is dropping a little bit. But it's just such a giant province that it has potential to have a really severe kind of caseload for quite a while now, especially because it's going to be quite a while before vaccinations can catch up.
Yeah. And of course, booster shots with the Moderna, I think, are in the pipeline too. He was saying that the mRNA vaccines are on the way, and they are targeted for healthcare workers. So that's a bit of a relief. I don't want to go too much down a rabbit hole of conspiracy, but can you see a scenario where meting out vaccine becomes sort of a way of creating opportunity for favored candidates in the presidential election? Like if you, it comes up the works, right?
Yeah, there's a lot of weirdness there, like you said. How does it go? Who makes the decision about who gets what when everybody is clamoring for this still very limited stock of vaccines? And that's very opaque right now. I think until now the rationale has generally been to prioritize Jakarta, which is sort of justifiable, I have to say, actually, just because it did have the worst caseload over the past couple of months. But now it's with the numbers in Jakarta coming down, having fallen by a third over the last week on a moving average basis. There's a rationale for trying to move the vaccines out elsewhere, perhaps. It's a tough decision, both on a scientific basis, not to mention the politics that can enter into it, because a lot of the governors of the major provinces on Java are potential presidential candidates, especially Ganjar Pranowo in Central Java and Ridwan Kamil, West Java, even Kofifa and Parawansa in East Java. So yeah, there could potentially be a lot of gumming up of the works for sure.
Yeah, you wouldn't want any one of them to shine too bright. You would be, if you were a dishonest actor in the central government with a venal bent, I could see a scenario where you would want to make sure none of them get too far ahead of you. I'm actually in Bali for a few reasons, and while I'm here, I've been working on some stories, and Bali hasn't been very much in the headlines, but there's been I've managed to get across some reporting. The story in the paper is going to be out on Sunday that said that oxygen supply is starting to run out. Average supplies of oxygen on hand in the Denpasar hospitals are running about 3 days, and usually it's 10. And new cases have doubled since the 13th. I haven't calculated the 7-day moving average yet. Forgot about that. And deaths were at 32 yesterday, and that was pretty close to a record of 33 on Thursday. It's worrying. And especially when the province has been in shutdown for 16 months and relies on tourism for about 60% of their economy. I wonder if this is if this is another hotspot that gets overlooked. But the officials here are struggling to keep the pandemic at bay. You always hear them talking about not wanting what happened in Java to happen in Bali, but it looks like it might anyway. So something to watch. Go to straitstimes.com, subscribe, and read the piece. Also I did a little piece on Pechalan.
Oh, yeah. Right.
Yeah, and they are not Ormas.
Oh, yeah. The community groups there that you find all over Bali.
The guys that make you wear a sarong to go into temples and enforce the day of quiet, the Nyepi day of quiet, silence. Should be more of those, I think, in Bali anyway. So I've never run afoul with them, and they were fine with me. And they took me around on their flatbed truck to go on patrols. And then Indonesian friends of mine pointed out, everyone on the street thought that you were arrested. I hadn't thought of that.
Yeah, this is how rumors get started.
Yeah, so there might be stuff on Instagram with me in the back of a Pechalan truck.
Yeah. Jason.
Anyway,
Justin Trudeau is going to mobilize in Ottawa.
That's right. They'll be sending Canadian commandos after me. Well, but no, it's a serious interview. We are deeply grateful to Governor Ridwan Kamil, almost a friend of the pod, but it looked like he had he didn't have a moment to spare, but he spared it for us. So we're honored.
Yeah, and he also really tried to emphasize a little bit of a political message, actually, or a leadership message, which was to stress that people are coming together in West Java and helping one another, and so that maybe there can be something constructive coming out of this disaster that the province is suffering right now. And so, he wanted to convey that message very clearly, and he asked us to do it. I think just clear communications are really crucial in a time like this. So that's pretty much what he was providing, and he did so in very good English. So,
the guy is just razor sharp.
Yeah, he's a trained international. Yeah, he's a trained engineer. He's an international architect before he became mayor of Bandung in 2013, and then managed to win election in 2018 as governor, despite not having a party affiliation. So he's still very much an independent figure, not tied up with parties. But he's an interesting figure because he's much more internationalized than I want to say almost any other Indonesian politician I can think of, actually. And he's also quite independent. In the polls, he's trailing a bit behind the three leaders, but he has openly acknowledged that he would be amenable to seeking the presidency in 2024 if he had the opportunity. But with the other three leaders, Prabowo, Ganjar, and Anies Baswedan out in front, could be tricky for him to do that. But he could be, for example, a candidate for vice president, quite conceivably in 2024.
Yeah, I made a conscious decision on my part. I don't know about you, Kevin. I sort of got the subtext in our messaging back and forth. Like we got the okay. Just sort of how this went for everyone listening. How this went was Thursday at about 10 o'clock at night. I got a message from Leah and Dani, who is one of his minders, who said, "Okay, yeah, we've got some time for you. Are you ready to go?" And I said, "Yeah, when?" It's like in 10 minutes now. When? And so we were messaging back and forth, and I didn't get the feeling that our interview with him was the time to bring up 2024. It seemed a little bit frivolous, and he'd already made those comments. But it's worth noting that he's got to somehow navigate parliamentary politics. He's got to get backing of a party, and it's not clear to me how he does that. I think the country, it would be great to see him in a race. I think he's got a lot to bring, but he's got bigger fish to fry right now, and I just didn't want to ask the question.
Yeah, exactly. Yeah. Mm-hmm. Yeah, at the outset of the pandemic, some of these regional heads clearly tried to stamp down transmissions and then leverage that as success to boost their profile in politics until they found out that it's too difficult to stamp down transmissions. And so no longer are any of these regional heads trying to link their performance to the case rates in their region. Instead, everybody's just trying to mitigate the impacts instead. And so that's very much his focus now, I think.
But something that I want to continue asking that's going to sort of feed into my interviews, I think, going forward, is trying to get a sense of how this is not going to affect the 2024 field, but how it's going to affect views of voters and what they expect from government. And the reason for that is because I think you would agree that what Jokowi's candidacy and presidency, his whole public life was really about, it started in 2005, was redefining the relationship between the government and the people, where the government is meant to be this mechanism that serves the people rather than the other way around, as it's been.
Yeah, exactly.
Since before Reformasi.
Colonialism, yeah.
And I wonder if COVID might turn it around again, where we're not only are you meant to serve us, and not are you accountable to us, but you really need to come up with the services as well. We're tired of being on our own. So I didn't get a chance really to ask him that because it's an emergency. Like, can you tell me what you think about in the next 4 years? But I think that's a theme that I want to stay.
Yeah, because I think that the pandemic is showing people around the world that local government is something that really matters. It's forcing everybody to pay much more attention to what's happening around them very locally and what their local officials are doing. And lots of times in the ordinary course of things, people overlook that level of governance, and especially in Indonesia. And in Indonesia, that's one of the crucial kind of venues for recruiting leadership. And so it's good that it's focusing more scrutiny on the performance of the district chiefs and the provincial governors.
And the country has been well served with fairly competent local leaders. I don't want to sing Governor Ridwan Kamil's praises too much. I mean, that's not my job, but just any objective analysis would say that his administration, Ganjar Prano's administration, Kofifa's, many of the cabinet ministers, they are remarkably clean and capable and well-intentioned. It can get messed up in the delivery sometimes, but they've also been able to model the type of the behavior which may not stay. Now the populace wants more.
Yeah, exactly. Yeah, it's whetted their appetite, hopefully.
Yeah, whetted their appetite. Now they want more social services. So it's, I want to wrap this up in a second, but it's one of the reasons why I really like being a reporter here. There can be really bad actors, but there's also just so many great examples of well-meaning administration who are competent and capable and get rewarded at the ballot box. And it's just really, it's gratifying.
Yeah. There's no end here to the drama, or as they say in Canada, the drama.
What are you talking about? All right. On that note, Ridwan Kamil. Joining us is the governor of West Java, Ridwan Kamil. But Governor, we are thrilled to have you with us.
Thank you.
We don't want to take up too much of your time. You have quite a lot on your plate, I'm sure. I was wondering if you could communicate for our listeners the seriousness of this moment. What are you facing?
Yes. Currently, as you know, we are having an emergency situations, due to two things: post holidays situation, and also the Delta variations is also happening in West Java. It's not only in West Java, of course, but as a representations of what happened. West Java is the most complex province in Indonesia. As you know, we have 50 million people. So you can imagine, I have to save life is a number of life in South Korea, for example. Yeah, same, more or less 50 million people. So what we do now is we have a top-down approach that the island in Java and Bali must use one strategy. That's a bit different than 2020. 2020, the strategy to fight COVID was given as a bottom-up to cities and regions, creating a not so cohesive approach. Yeah. But since January 2021, we use a different approach, including today, we do a semi-lockdown to handle the COVID. So since the early July, we see a surge of our case number, and one of the statistics that we always use is bed occupancy ratio in the hospital. So after several weeks, we have a trend of slowing down, but not so much. Yeah. But the occupancy ratio is decreasing, thank God. I remember 2 weeks ago, our bed occupancy ratio was reaching around 90%. Now, today, as we speak, a report just came, we have only 75%. So hopefully the next coming days, we will reduce and we will see no longer people queuing at ICU and get treated on the parking lot, for example. That days are behind. So we are now focusing on that one. But one fact you have to understand also, I think 80% of COVID patients in West Java are located at homes. Yeah, we call it independent isolation. Yeah, home isolation is 80%. 20% divided into 3 locations. First is the hospital. Second, isolation center at the rural areas. Yeah, we have 5,000 villages. We order every villages to have an isolation center, at least 2 or 3 beds, occupy 50%. And also we have what we call post-recovery. So we move people from hospital that about to be recovered, maybe 80% recovered. We move them to hotels, apartments, in order to give rooms to hospital for really needed patients. So this strategy of handling home isolation, village isolation, and move some patient to hotel apartment, creating rooms for needed COVID in hospital. And as I said, 90% last couple of weeks. Now, today is only 75%. Second issue is increasing the vaccine. As you know, it's a bit challenging because the way we do here is we wait the supply from the central government. So me and my team at the regional and local level, currently we are waiting for another round of supplies of vaccine. They said 50 million vaccine will come by first week of August, which is next week. So hopefully you will see an increase of numbers of vaccine. West Java, because of this quota, only reached around 60% in total out of 33 million. That's about 70% from 50 million. for herd immunity kind of numbers. Yeah. But the good thing about Indonesia in terms of vaccine, I have to tell you, and this is fair, yeah, we already secured the contract for long term. So if you can compare to other country, we have lots of supply from anywhere by the good work of our Ministry of Health. So we securing vaccine a long time ago. So now we're waiting another round of incoming vaccine from Sinovac, for example, from Moderna, from Pfizer, and many other vaccine brands. So in terms of vaccine, we do not too much worry. It's just waiting for the vaccine to arrive. We have an issue in terms of this emergency semi-lockdown because people start to feel the economic got impact big time, especially the informal sectors. So there's an increasing resentment about this, I have to say. So the last 7 days, we already released the social safety net in the form of daily foods, in the form of cash, yeah. But I have to say, not all the people are counted formally. So as a governor, after this, for example, I will deliver daily food and cash to undocumented new poor group in the streets of my province. So the next 2 days, I will use my motorbike. Why I use motorbike? Because it keeps me safe. Because I can have social distancing using this kind of mode of transportation. So this is what I'm doing now. Yeah, 60% of West Java covered by formal social safety net, but I think there are 15% informal sector undocumented that also hungry and needs some help. That is why we do things. Oxygen supply is also an issue. We are deficit 400 tons a day. I can only buy and search outside, especially also from Singapore, extra 200 tons, but we still deficit 400 tons. So I just have some conversation with Australian counterpart this morning. We are buying oxygen concentrator because moving the liquid oxygen is very tricky throughout the archipelago. So we are hoping we can buy this new technology, oxygen concentrator, that basically you grab oxygen from thin air using a machine, yeah, but only for light condition patient. For ICU related that need ventilator, that's a different case. So, and because of this, I learned to prepare for another round of maybe third wave. Yeah, hopefully not. But so I already now prepare what we call oxygen departments in my task force. We already set up free medication. So I stopped 11 infrastructure projects last month. So I changed it to buy free medication because there are cases of fatality at homes. They call the doctors. Doctor is too busy. They ask for medication. It's not existent in the pharmacies. So using social media, I learned so many people complain and ask for help. So last 2 weeks, I decided last month I stopped my infrastructure. I set up what we call telemedicine. So surprisingly, only 4 days from I founded telemedicine, 40,000 questions, yeah, arrive from confused patient. Maybe 13 doctors were deployed to answer this 40,000 questions. 90% answer. We deliver 20,000 package of vitamin, supplement, and free medication. We secure the contract from local pharmacy. So basically, this is how I handle reducing the bed needed in hospital, creating 75% now occupancy rate from 90%. The patient at home, I send free medication, free telemedicine, and also free oxygen cylinder, small one. I lend them, so they borrow from the government with the commitment when they finish, they can lend to another needed patient at home somewhere. Because as you know, we are not homogeneous. We have cities, but majority are rurals. So territorial issue is totally a challenging task for me to tackle this issue during the pandemic. And lastly, we are happy to say one of the best thing in Indonesia and today is people help people. Yeah. So many initiatives. I counted more than 25 initiative from online donation, crowdfunding. They buy oxygen concentrator and send it to hospital. They send foods to home isolation patient, for example. They send many support. So I think one positive side during this crisis is I think the sense of solidarity is very high, which I'm very, very happy to indicate that fighting of COVID is no longer a government business, no longer a government responsibility. Our crisis is our responsibility. Everybody is helping each other. So I think there is still crisis side, but also there is a positive news and some inspiring news also. That's basically what happened in West Java.
Maybe there's a constructive experience that will come out of the disaster. Yeah, I wanted to focus on the healthcare workers. They're suffering a terrible predicament. What is the situation in West Java with healthcare workers suffering infections of COVID-19 now?
Yeah, as you know, I can compare two data here. During the Christmas and New Year's holiday, we have the same situations. Yeah. Wherever there is a long holiday, there is a surge of cases in Indonesia. And the decision to have a long holiday is always a domain of central government. So during the Christmas and New Year's holiday, the number of cases happen to us, also to health worker, is not so much. Yeah. But after this Muslim holiday, we conclude from 100% sample that we test, I think 70% is a delta variation. Yeah. So this delta creating a very fast time of infection. During Christmas and New Year's holiday, less child and teenager got infected, for example. But now, 90% of our new cases happen to children and teenager also. So you can see how dangerous this Delta type of COVID. And this means also it affected many the health workers. Yeah, so I got some complaint from hospital, Mr. Governor. 50 of our staff got infected. 100 of our staff also got infected. Even though we are super disciplined in using people protective equipment, for example, but somehow they get affected. But when I check, it's not in hospital. The infection happened to health workers. It's happened during their return to homes. Yeah. So majority that I interview, so it means infection is not happening in hospital. Hospital is very strict, when it comes to protocol. So when I check why so many got affected, I think majority is from what we call it family cluster. So when they return from work, for some reason, maybe they forgot or they open during a meal, and that's what happened. So I think yes, we have some issues, but now last week we are creating a new volunteerism from students from the healthcare education universities or colleges to increase because we are in badly needed one for replacing the infected healthcare workers. Second, we need so many vaccinators to give vaccine. We need to train. Third, we need people also to do a tracking. So now, because of this lack of numbers of healthcare workers, central government is sending the military to tackle many things. So I think, in my opinion, this COVID is more or less an emergency to everyone. So the president is rely high and big time to military and police. So now police and military they got allocation for vaccine. They will do their own vaccination time and management using the military doctors, military or police doctor, and so on and so on. The military also asked to give free medication, as I'm doing also with the different team. And last night, the military was asked to do the tracking to the infected or probable contacts wherever they have in the village area. So I think that's what happened. Yes, they got infected, so we are replacing with new volunteer from medical schools, sending military also to replace some of the assignment of healthcare workers. And that's what happened today.
Yeah, the Moderna vaccine will roll out as a booster for healthcare workers as well. Will that happen in West Java?
Yes, that is the policy, Kevin. So they will have the third dose. In West Java, we have what the rate is 110%. So means the whole healthcare workers is already got the vaccine, including some administrative person. That's why the percentage is more than 100%. But we think we need to secure their defense. So we are preparing for the third dose for the healthcare workers. I think the policy is because the vaccine also, yes, available, but not really abundant. So the third dose, or we call it booster, is only for healthcare workers, not for a regular general public.
Okay. And how about social welfare assistance for the public during the restrictions and economic downturn? Has that been has the support from the central government been adequate in West Java for social welfare assistance?
Yes. Currently, in our system, as I said before, you can imagine, 63% of our people now are given our social welfare supports in the form of daily food and in the form of cash. So the cash is given by bank transfer, and the food is given is door to door, for example. But as I said, there are 10 to 15% undocumented. That is why I'm preparing a non-formal approach, asking many groups and community to help me give this donation of social welfare to undocumented groups, which happened after this meeting also. I will go. So I think the social welfare, number one, in the form of daily foods, another group in the form of cash transfer, number three, also in the form of the reduced electricity bill. So before you pay 100%, now you pay only 50% or 25%. Number three, in the form of for unemployment, they have also social welfare cash support, and also another group coming from different department for different professions. I think in total, the central government is releasing around, let me say in US dollar, I think around 3 billion US dollar for social welfare support, or 50 trillion rupiah in Indonesian rupiah.
The pandemic is affecting infrastructure development, perhaps, and is it also affecting the workforces in factories in the industrial areas of West Java? And are the factories managing their workforce appropriately when infections occur among the workforce?
Yeah, I tell you also a bit good news here. In macroeconomics that we have, surprisingly, the numbers of incoming investment is not affected. So we have 1.4 billion US dollar coming the last 3 months, for example. Our export also number one in Indonesia is around 16%, the biggest in the country. Our unemployment rate also is having a better performance. Pre-COVID, our unemployment rate is around 8%. During 2020, unemployment reached high 10.5%. Last month, our unemployment is only 9%. So it means macroeconomy is doing okay, yeah. But because of Delta virus, we have to, take a break and slow down. So I don't have any updated data related to this macroeconomic. But before this semi-lockdown, our economy is doing okay. Yeah. Also, the industry, which happened to be 60% in West Java. So total industry in Indonesia, you can imagine 60% in West Java. So when there is an order to limit mobility, I have a difficulties to reduce the number of mobility in the industrial cities, because they have lifestyle way of working shift by shift. So nighttime they are busy, daytime they are busy. So we give what we call two definition, Jeff and Kevin. If you are critical or essential business, you can still work as usual, but you have to show that you follow the protocol, for example. And in order to make sure you are part of the critical or essential sectors, you need a permission letter from the Ministry of Industry. So it means, yes, some industry we close during this semi-lockdown. Only we give open to the ones that have the letter of permission from the Ministry of Industry, to make sure essential and critical sector is not affected. That's what we call semi-lockdown, because economy is still working. Yeah, people can buy things, but you cannot dine in. You have to buy takeaways. Yeah, but whatever is still affected many informal sectors big time. So that's what happened from the factory, and we found some incidents or some modus operandi also. Some factory they do not report whenever they have a case in the factory. So we have 200 what we call it sanction to this factory, in total around 200, because they're not following the protocol. Some of the modus operandi is they're not reporting wherever they have infected workers. They just ask worker to go silently. And what happened? This worker infected the homes and the residential area. So for this type of modus operandi, around 200 we already close temporary until they commit to comply to the protocol.
One last question, Governor. What percentage of the population is vaccinated now, and when do you think a majority will have gotten both doses? You say that you have a line on a supply of vaccine. When do you think you'll hit that herd herd immunity?
We got the quota. We got the quota only 9%. Yeah, 9 million. So West Java population is 50 million, right? In order to get close to 70% of herd immunity, mean 70 times 5 is around 33 to 35 million. That's the biggest in the country. From 33 to 35 million, we got quota only 9 million. So the 9 million is almost finished. So many cities asking, Pak Governor, give me more vaccine. The last couple of days I said, I don't have, because the next batch of 50 million of vaccine will come as early as the first week of August. So to answer second question, I cannot answer because I cannot control the supply. But hopefully by the end of the year, hopefully I can get the majority vaccinated with the condition that the supply from the central government is proportional to our big populations.
Thank you, Governor. Thank you so much for your time.
Thank you very much, Pak Governor.
Okay, I hope my information is useful. Hopefully you can cover both sides, yeah. Some maybe not so good, but some inspiring also, because we need also to inspire people. People are too tired. They got angry, they get apathic feeling and so on. So we need also media to play part to support, especially the people, help people. I think you should cover that area also. It's beautiful thing. But hopefully next couple of weeks, we will more or less can handle much better. Yeah. Thank you.
Yeah, we appreciate your clear communications, because that's a big factor. Thank you.
And that's our special edition of Reformasi Dispatch. Thanks to Governor Ridwan Kamil for joining us. Our producer, as always, is Stephen Handoko. Editing by Aditya Akbar. Music by the Blue Dot Sessions. For a free 1-month trial of Kevin's invaluable Reformasi weekly newsletter, go to reformasi.info. And if you're listening to us through a podcast app, please subscribe and rate us. It helps. As always, you can reach us at hello@onthelevel.id. This podcast is a production of On the Level Media. I'm Jeff Hutton. We'll see you again on Wednesday.